Professor, Physician, Epidemiology. I am Dr. Sri Banerjee. Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy, Walden University, and in this video I'm going to be going over quickly this interactive dashboard that I created in ArcGIS within the cloud-based app. And I would like for you to use this interactive dashboard to not only take a look at what is going on maybe within your county, even between the years of 2006 and 2017. Have your trends been looking like this, going down, or have they been more going up? And the way to kind of figure that out is take a look at the color of your county. If it's light blue, that means it's higher opioid prescribing practices. If it's a lower color, kind of lighter color, then lower opioid prescribing practices. So when we look in Altoona, it's kind of some of the prescribed practices have declined. Now, just as a note, there's a lot of pain-related stigma that pain really automatically means that this is a part of some sort of pill-seeking sort of behavior, when in fact it's much more complex, much more complex. And unfortunately, there's not been enough research done into understanding chronic disease and the relationship of pain. So instead of placing blame on necessarily, I think it's important to also collectively look at this as a whole and understand the area of pain management in a more complete manner, so that we can understand all the social factors surrounding it as well. Thank you for listening. Also, if you would like more information as to where this map is located, or directions on how to create this map, I have extensive tutorials available elsewhere where you can find this. But I actually created this this line graph myself, and the way, if you wanted to actually look for additional potential opioid maps, the way you would do that really is you would go into Add Layer, and then potentially in Living Atlas or ArcGIS Online, look for a potential layer, and then go from there. So that gives you a little bit of context of the opioid crisis, and I want you to take a quick look before I end this video actually at another thing. Just look at the patterns, and I know there's a lot of names covering the colors, but you can see the Appalachia region being kind of the highest region in pain prescribing areas. There's also areas out west where there's higher rates of pain prescription prescribing. So there's prescription drug monitoring programs and things like that, which have been put in place in order to kind of make sure in the general population there's not as much abuse, substance use, and things like that. But unfortunately, as I've mentioned in other videos, people find other means to kind of satiate their addiction. So fentanyl has been something that has recently been used along with heroin and other substances. Anyway, so that's kind of extra information not contained within the scope of this this video. The main focus of this video was the geospatial patterns in prescription drugs and opioid prescription drugs. Thank you for listening.